And I'm going to give you an overview of the Department of Surgical Oncology. This is not only Department of Surgical Oncology, but also the Department of Surgery, from where we took the roots. The Department of Surgery has a glorious history, and this was surgical oncology from the great banyan tree that we started. These are the great visionaries who laid the foundation of surgery and surgical oncology. My father, Dr. G.C. Sharma, Dr. P.K. Vanchu, all the principals, superintendents, without whose help this wouldn't have been possible. We think that people across the road have a very cushy job. But mind you, you go and sit with them for a day and you'll see they are putting in their time, money and effort just for the development of the department. So kudos to the administration. Surgery is the mother of all specialties. You see, orthopedics was started by Dr. P.K. Sethi, pediatrics by Dr. Sogani, neurosurgery by Dr. Salim, plastic surgery Dr. Chandalia, neurology Dr. Galwal, CTVS Dr. G.C. Sharma sir. The Birla Center was started by Dr. Vanchu, surgical GI lab K.M. Bhargav sahab and J.M. Mehta sahab, laparoscopic OT Dr. Jindal and Dr. A.K. Mathur, gastroenterology Ajay and Ram Daga. And then we also had our origin from Department of Surgery. Seeds of surgical oncology was sown by Dr. G.C. Sharma and Dr. Vanchu. Dr. G.C. Sharma, my father, was former principal and professor and head of surgery, and Dr. P.K. Vanchu was professor of surgery with training at Sloan Kettering Memorial Hospital, New York. A donation by Sri Radhakrishnan Birla family started the RKBC Cancer Detection Center. Foundation stone was laid on 7th of April 1987 by Chief Minister Sri Haridev Joshi at that time. And inauguration was done on 13th of August 1988 by the then Chief Minister Sri Charan Mathur and Health Minister Sri Raghunath Vishnoy. This is a photograph from Tata Memorial Hospital, which is like a sister institution to the Department of Surgical Oncology. And all these people from our seniors, teachers, professors, who really helped to develop the various specialties. So these are the foundation stones. 1987, the Birla Center one part, 88 the other part, 91 we built the first floor, and then in 2007 we had the bone marrow transplant and other programs. At that time we were doing 30,000 OPDs per year, and we had all the facilities like fine needle aspiration, cytology, bone marrow biopsy, dressings, chemotherapy, mammography, lymphopress, colposcopy, and everything. And we started the cancer registry in 1991. So just to give you progress and development dates, the Birla Center was started in 87-88, Cancer Clinic and Registry 91. Oncology wing, this was originally the building, and then we got a grant from the center. Hemant had a very big role to play in this, and all the departments of radiotherapy, medical oncology helped us to build this. And we then had the surgical oncology wing in 2008, division of surgical oncology in 2010, finally the Department of Surgical Oncology in 2016, a new unified oncology OPD in the Dharmadri block 2017-18, prefab board in 2018, and the State Cancer Institute finally in 2019. We had a glorious past. We did the first video workshop of the country. Dr. A.K. Mathur will remember. This was somewhere in 2001. This was the first country's video workshop, and the whole of Tata Hospital people had come here to do this workshop. The surgical division of surgical oncology and surgical unit was announced in the conference ISO NatCon 2004, which we organized, and then finally the MCH program and state-of-art ward. This is my loving theatre in the Birla Cancer Center. This was a single room theatre which we started, and it was started by a lot of donations. The cardiothoracic people donated us the gowns, the sisters in the OT donated us drums, and you can see how meticulously our OT in charge kept that single room operation theatre. And we had all the facilities at the Birla Cancer Center. Then finally, when the trauma center was made, we got this old trauma OT building. So we started with the blessings of the Almighty, and this is here you can see Dr. Suresh viewing the theatre. And this is what it is today. We have all the facilities there. And I'm going to talk to you about something like which is this on the drip stand. And then finally, the Dhanvantri OPD block. Very few people have the privilege of making the drawing and then sitting into that institution. And this is the place, you can see Hemant there. And we had the privilege of making the drawings, and this is the Dhanvantri OPD block. Mind you, this is the place I was born. These were the hospital bungalows, 4 bungalows, bungalow number 1, 2, 3, 4. And first was the principal's bungalow. And this is the place I was born. And it is a rare coincidence that where I was born, I had my OPD. And this was inaugurated by our principal, and this is, you see, it's as good as any modern hospital anywhere. When the Charak Bhavan was made, then the old ENT ward got vacated, and we got that ward. Although it was an old ward, but still we managed to make it into a very good ward. And then finally, we had this prefabricated ward, which is an ultramodern ward. You can see it doesn't look like SMS. SMS is making progress in leaps and bounds under the leadership of Dr. Bhandari. In 2014, the then Chief Minister Vasundhara Raje had the idea of starting a state cancer center. So she got all of us together, the radiotherapy people, the medical oncology and us, and she said, you have to start this. So she had sent people to the Champalimud Foundation, and so we sat down, we started making the plans, we had this, and this is the building coming up. You can see Dr. Dana, everybody chipped in. They used to go there, see how the building is coming, how the theatres are coming, what is the construction going on, and this is what stands today. You must go and see this building, the State Cancer Institute. This is not a photoshopped picture. Can anybody believe that this is Jaipur and this is the State Cancer Institute and this is the SMS Medical College? And ultimately we plan, Dr. Bhandari has planned that we will have 7 floors on this, and it will be a comprehensive cancer center. Because of the COVID, we did not have a formal inauguration, but with the blessings of the Almighty, a small little puja, we started this in 2019. And this is the theatre, I can tell you, it is the ultimate theatre which anybody can dream of. You have all the facilities there, it has integration. Thanks to Dr. S.M. Sharma, who got us all the equipment that we required. And he did not say, he said, get the best of equipment. So, and we got the best of equipment. This is the ultimate. Sitting here, I can watch what is going on there. I can see the patient parameters. I can talk to them and they can talk to me. So it is the ultimate theatre. Very few people have been able to see such theatres. This is the ICU at the State Cancer Institute, and we celebrated the Independence Day, last Independence Day there. Regarding the faculty, we have 2 senior professors, 2 associate professors, 1 assistant professor, 8 MCS students, and 2 posts with the help of Dr. Bhandari of assistant professor have been sanctioned recently, and we hope that RPSC is going to advertise soon. As far as the work output is concerned, total operations about 2,000, admissions about 2,500, and combined surgical medical oncology OPD is about 30,000 per year. As far as the facilities are concerned, I'm going to just give you a pictorial view of those, but just to read out. We have OPD services, indoor 40 beds, and you can see we have, it's more of a family rather than a team. The head of the department is Dr. Raj Govind, and he has many accolades to his credit. Why I'm showing you all this, that you have facilities, this is because of SMS. Anybody who is an SMS can get various fellowships, various grants. Why? One, because SMS has a big name. Two, SMS is a teaching institution. Three, SMS is from the third world countries. And four, SMS alumni is all across the globe. So you throw a stone and you'll find an SMS alumni somewhere in the world, and they'll be ready to take you. So apply for fellowships, go out, go abroad. See, Dr. Suresh is a senior professor, Department of Surgical Oncology, trained at Tata Hospital, more than 12 years experience in surgical oncology. He has a head and neck fellowship with Dr. Jatin Shah, who is the father of head and neck oncology. Dr. Yuman Fong, people must have heard the name of Dr. Blumgard and Fong. So he's been with more than 25 publications, and he has a gold medal for SERAJ. Dr. Pinakin Patel, he's got 3 years residency in surgical oncology, more than 10 years experience in oncology, member of associations, various associations. He has 16 publications, and he is the business mind behind all the equipment purchased in our department. He's got the best of the best equipment that were possible. He has great negotiation skills. Dr. Kamal is MBBS, MS, MCH in surgical oncology. He is an alumni of SMS, MS from Banaras University, MCH from Kidwai Memorial Institute of Oncology. He did his observerships in USA, more than 50 publications, and he's taking care of the curriculum. Dr. Akhlaq Hussain is MCH from Lucknow. He recently joined the department. I can tell you, very few departments have the privilege that the whole faculty is FACS. Now, all the faculty is now fellow of the American College of Surgeons. Put together, we have about 80 to 90 publications. Noteworthy is Cancer Profile in Rajasthan. This is the only available database of Cancer Profile in Rajasthan. The other one is telementoring, which I'm going to talk to you. The cancer registration started in 1991. We used to publish the cancer data like this, and these are the original landmark papers which have been published in the Indian Journal of Surgical Oncology and Indian Journal of Cancer. And our faculty has also contributed to book chapters. The long cherished dream was finally fulfilled with the sanction of MCH in surgical oncology in 2019. And these are our children, batch of 2019, batch of 2020. Wonderful people from all over the country. We have a very strict teaching program, morning classes. Now the classes are from 8 to 9. And 1 hour class, cases and their management, mortality, morbidity needs, NCC guidelines, surgical discussions. We also have a very different sort of a thing, a skills development class. Every evening, 1 hour based on the surgeries done, and these are one of the diagrams that these residents make. We take care of the residents. Residents' room is fully with air conditioning, LCD refrigerator, desktop, everything. In-house library, and every day before the round or during the rounds, we have a whiteboard teaching where these residents have to teach us. We have strict quarterly examination, and despite the examination being held 4 times a year, you can see the smile on the faces of the residents. This is what got us the international recognition. We are a part of the International Telementoring Club. This was our old probably Dr. A.K. Mathur will remember the one single chip camera which they discarded. And we took this camera and mounted it onto our OT light on a drip stand, and this is what we got. And this was published in the Indian Journal of Cancer, and this has got us into the International Journal of Telemetry, International Club of Telemetry. This was on the drip stand. You can see the camera. It is recording everything. It is displaying on the wall. Here you can see high resolution images can be seen anywhere in the world. Patient data is there. The whole thing is there. So you can sitting here, you can see anything anywhere. We have the first fuse. We did the first few mandibular reconstructions for cancer, the sentinel node biopsies, breast conservation surgeries. We started other complex surgeries. We were the first one to start implantable venous access devices in ports. Core biopsies, stoma care, colposcopy, use of oral morphine, the cancer registry, and the first computer in SMS was in the Birla Cancer Center, if you remember. This we got the best Operation Theatre Award in 2016. We lay very much importance on the safety in surgery. We have the surgical checklist, which is being the first line on this is inform the chief. Who's the chief? Our chief or the anesthetist. Beyond that is the Uparwala, because always you have to inform, and at the end you have to inform the chief that thanks for the safe surgery. We got the best award of SMS in 2017. Many of our staff have been felicitated for exemplary work on Independence Day and Republic Days. Various academic activities like workshops and conferences. Live relay, this is another unique thing. From Tata Hospital, we did live relay. Every year we do that. This is the only place in the country which the Tata Hospital relays live surgeries to. And this has been going on since 2011. You can see every year. Our motto was, don't let the faculty go out. Let the conference come to the faculty. Only one faculty can go. But if you have the conference here, the whole residents and faculty can attend. So even from London, we had a live relay. We hands-on training in staplers, energy devices, the laser we are going to acquire now. And then you can see Dr. Pinakin trying his hands on the robo, which I'm sure under Dr. Bhandari's leadership will be sure to come in the next few days. We have interdepartmental teaching and learning. We learn from the other departments. This is the anesthesia department trying to teach us resuscitation. We have a very good dental and prosthetic services. This is Dr. Ashwar Chatterjee, and he makes prostheses for our patients. Head and neck patients are the commonest. We train our OT staff also. We send these are our OT staff who have been to Tata Hospital, who have been to Delhi for sterilization techniques, for OT techniques. We have multidisciplinary educational programs. This is from Tata Hospital that he had come. We have the multidisciplinary tumor board. Twice a week, all the departments come together. You can see the pathologists, the radiologists, the medical oncologists, and discuss the various difficult cases. We have a very good Dr. G. Sharma seminar hall where nowadays the pathologists sitting in the pathology department, Dr. Arpita is here, Dr. Dilip, they sit in their department and we discuss the cases in that tumor board. All wards are under surveillance. It is well known fact that we perform well when we know that somebody is watching us. So all wards are under surveillance. We are part of the National Cancer Grid, and we have tumor boards of the National Cancer Grid twice a week. And this is a very interesting thing shared by the National Cancer Grid. This is the Tata Hospital, and these are the people who go to Tata Hospital for treatment every year. And this was shared with us that you see that from Rajasthan, very few people go. So it speaks volumes for the services in Rajasthan, in SMS, and under the leadership of Dr. Bhandari now, we are going to have less and less people going out for treatment, and we are going to have more multi-specialty things here. The National Cancer Grid also donated during the COVID time. They have donated BiPAP ventilators, and they have also donated the high-speed fiber line to us. All our wards, all our theatres, all our OPDs are free Wi-Fi, high-speed Wi-Fi, and that is why we can do these telementoring programs. We not only do academics, most of our students don't come from the English background. So they lag behind and lack confidence because of that. So we had an English speaking and personality development workshop also, where people learn English speaking and how to speak. We have various grants and fellowships, and Dr. G. Sharma International Fellowships, Dr. Mahesh Verma Development Fellowship. These are the people who have availed of all these fellowships in the department. These are the recipients, these are the young boys, bright boys who have gone abroad on this fellowship. Significant achievements of our residents and faculty, these are the people who have been selected from the surgery and surgical oncology. Everywhere in the country you will find our students there in any of this. And Dr. Jyoti was selected as Assistant Professor in Surgical Oncology at New Delhi AIIMS. We do public education and awareness programs. Dr. Raghu Sharma was here for the poster exhibition. These are the posters that children make. We have cancer detection camps, Cancer Survivors Day, student participation. We believe that students should come and help us. These posters that you see in the wall, these were made by all these students. We have a link with the Indian Institute of Health Management. Their students, we go for lectures there and their students come here. These are some of the students who have never been to a general hospital. We put them on a task, we send them to the OPDs, we let them do stand on the queues, and then after that program they come and tell us, sir, this is the first time we realized what hospital management really is. They thought Fortis and EHCC are the general hospitals in India. We have an international visitors program where people from abroad keep coming here. This is a post-laryngectomy speech. Japanese trainer who themselves had a laryngectomy. They came here and taught the esophageal speech to our patients. We involved in non-government organizations and volunteering training programs where they teach stoma care, prosthesis. We also have non-academic motivational programs, spiritual programs, and we also promote people to develop in the peripheries. These are two hospitals that we went for, one in Sikar and one in Savai Madhopur. In fact, let me tell you, 25 years back, it was our department which made the project report for the Bhagwan Mahavir Cancer Hospital. They have just celebrated the 25th year, and it was our department which made the project report, and we started this hospital. And this is finally the preventive oncology van with the efforts of Dr. Suresh. We now have a van which is going to go to the periphery. It has X-ray facilities, colposcopy, mammography, internet facilities, ENT evaluation facilities, and it's going to go to all districts. Also have the gamma camera. Now we're going to start the sentinel node biopsy at the State Cancer Institute. Our people, our faculty is an expert in mobilizing funds. Recently we got the anesthesia machine, a high-end anesthesia machine donated to the Department of Surgical Oncology. We believe if you keep your anesthetist happy, you will be happy. So we try and keep the anesthetist very happy. And of course I thought I must also talk, I forgot about talking about surgeries. We also do surgeries. We do complex surgeries. Every year we do about head and neck, 200 cases of head and neck, breast, 218, and all sorts of surgery spanning from head to toe. These are the varieties of surgery we do. This is small little Dr. Pinakin trying to take out a tumor which is bigger than him. These are some of the patients. Unfortunately, even in today's time, we see such tumors. And then after the hard work, we believe in playing around. These are the picnics that we go together. And our patients are thankful. They make drawings for us. And this was the biggest reward. A grandchild of the patient made this thank you card for us. We have done so much. We think we have done so much, but this is less than 1% in the spectrum of life. SMS Hospital is doing just this much. So much needs to be done pre-hospital, post-hospital, and I'm really happy that we have a leader like Dr. Bhandari who's thinking of these things. Recently, we had a visit by Dr. Bhandari and the Rotary people where they are planning a pre-hospital care, a post-hospital care, and something like where the patients and relatives can come. A full tower for the patients and relatives so that you don't see patients lying on the floor. And this is what I think SMS under the leadership of all the team will go leaps and bounds. And thank you very much. This is our happy, not the team, but this is our happy family. Thank you very much.